Ladies and gentlemen, the President of the United States, accompanied by Secretary Tommy Thompson.
Thank you all. Thank you very much. Please be seated. Thank you. Be seated, please. Thank you all very much. Today I'm here to talk about our most important commitment to our seniors, the health of our seniors, and how we can modernize and strengthen Medicare. I'm also here to announce an exciting new plan to provide every senior on Medicare an opportunity to better afford prescription drugs by the beginning of next year. I want to thank the members of both political parties, of all three political parties, who are here today. It shows a firm commitment to make sure our nation fulfills a solemn pledge to our seniors, and that is that our seniors have the best possible health care available for them. So thank you all for coming. We got many members of the House and the Senate, most notably Senators Breaux and Frist and Congressman Thomas, all three members who worked hard on Medicare reform in the past and who are joining with the administration to promote Medicare reform this year. 36 years ago this month, and thank you, Mr. Secretary, as well for being here. 36 years ago this month, President Lyndon Johnson flew to Independence, Missouri to sign Medicare into law and to present the first Medicare registration card to former President Harry Truman. President Johnson spoke that day about what Medicare would mean for our country, and here's what he said. No longer will older Americans be denied the healing miracle of modern medicine. No longer will illness crush and destroy the savings that they have so carefully put away over a lifetime so that they may enjoy dignity in their later years. He went on to say that no longer will young families see their own incomes and their own hopes eaten away simply because they are carrying out their deep moral obligations to their parents and to their uncles and to their aunts. Medicare has lived up to President Johnson's vision. It has improved the health of America's seniors. And it's eased the financial anxieties of retirement, reduced the burden on younger generations, and fulfilled our nation's commitment. Medicare is a binding commitment. The Medicare promise we made in 1965 will never change. And as medicine advances and the needs of our seniors change, Medicare too must advance, and it too must change. This generation of leaders must honor and renew the promise of Medicare by strengthening Medicare for the future. In 1965, health care usually meant hospital care. Today, we understand how important it is to prevent people from getting sick in the first place. Yet Medicare does not fully cover preventative medicine. In 1965, prescription drugs meant antibiotics. Today, illnesses that could once only be treated by invasive surgery are treated instead with effective new drugs. But these new drugs can be very expensive. And under the current system, Medicare doesn't pay for them. In 1965, medicine could offer people diagnosed with cancer and other dangerous diseases little hope. Today, we can defeat many once incurable diseases, but too often at a costly price that Medicare will not pay in full. In 1965, the pace of medical progress was relatively slow. Today, hardly a day goes by without news of an exciting advance to extend life or improve health. Yet Medicare takes way too long to authorize new treatments. We must act now to ensure that the next generation of medical technology is readily available to America's seniors, from medicines tailored exactly to an individual's disease, to internet diagnosis that will allow patients to be treated by experts on the other side of their continent without the patients having to leave their living rooms. In 1965, Medicare's finances were based on assumptions that quickly proved wrong. This has had enduring consequences. Medicare has too many limits on coverage. Seniors enrolled in Medicare are responsible for a nearly $800 deductible every time they visit a hospital, and may find themselves responsible for paying thousands more if they are seriously ill. Medicare's funding structure doesn't make sense. Two different parts, one of which appears to have a surplus, even though the other has a much bigger shortfall. And Medicare's costs are rising too fast, which creates anxieties about the program's stability. It may be that cars don't get any better than the 1965 Mustang. But even the 65 Mustang didn't have power windows or anti-lock brakes. When it comes to cars and when it comes to health care, 1965 is not the state of the art. We need to bring Medicare into the 21st century to expand its coverage, improve its services, strengthen its financing, and give seniors more control over the health care they receive.